Today, we're excited to announce Flexpa's Consent 2.0, a complete revamp of how patients authorize access to their health data. Here's the challenge. Your health data lives everywhere, and most of it isn't in your own control. Your insurance claims are with your payer, your clinical notes are scattered across different EHRs, your historical records might be at different facilities that you visited years ago and are hard to track down. Maybe they're even in a different state. The technical pathways to access each of these are completely different as well. Different APIs, different authentication methods, and different eligibility rules. Flexpa Consent now provides a unified interface to deal with all of these different data access patterns. Payer-sourced claims data to provider and EHR-sourced clinical records, and now a nationwide record discovery via TEFCA IAS. With all this complexity, we've also reimagined the consent experience as a whole. It's mobile-first and built in a manner that emphasizes the gravity of data sharing while still maintaining speed and ease of completion. Let me show you the TEFCA flow first. TEFCA is our newest capability. It enables nationwide clinical record discovery across tens of thousands of facilities in the United States. Let's say you get a text from your doctor's office asking you to check in. It brings you to the Flexpa flow. For TEFCA, patients need to verify their identity with an IAL2 credentialed identity provider. We support both Clear and ID.me so that patients have a choice. Once they've authorized successfully, Flexpa's handling everything behind the scenes here. We're querying across all the QHINs on the network, discovering patient records and facilities nationwide, and retrieving their clinical documents. If everything looks right, the click looks right, and at that point we have begun syncing all their records from these facilities. Now, TEFCA is a one-stop shop to get your records across all facilities. However, there are reasons why a developer or an application or a doctor's office might also want you to sync your payer-based information. So payer-sourced information includes claims, financial adjudication, as well as medications that were picked up at the pharmacy. Both payer and provider APIs have hundreds of endpoints, each with their own eligibility rules that don't match up to a patient's mental model. We see this time and again as we try to route users to the right locations. Let's take the BCBS example. I'll go here to the AI assistant and say I have BCBS. You can see that the AI talks conversationally and will guide the user through all the questions necessary in order to route them to the right endpoint at the end. The AI knows that BCBS operates in different states, so it's asking what state we're in. So we can say Texas. Great, at this point you see that it says looking up insurance providers. It's going in the backend and actually looking up information in our systems. So it's looking up all of the endpoints, it's looking up their coverage support, it's looking up eligibility rules, and it's looking up any pertinent information that's specific to this health plan that we have documented. Now it needs to know what type of plan we have. So what if we say, I don't know? It'll help guide the user through all of the questions necessary in order to figure this out. Say I know that I got it from healthcare.gov. It understands that if I got it from healthcare.gov, it must mean that I have an on-exchange individual plan with BCBS Texas. After checking our coverage in the backend, it confirms that we can connect. And before connecting, it's doing a little bit of error prevention. So do we have an online account? And do we know our username and password? I can say yes, we do. Great. At this point, it's giving us a little bit of a heads up on what's going to happen next, and it provides a link to authentication. So that's Flexpa 2.0. Behind the scenes, we're routing across 3 completely different technical pathways: payer APIs, provider EHR APIs, and TEFCA QHINs. Front of house, we've made the workflow simpler, easier to navigate, and smoother for the user experience. The workflows that you see here are modular, swapping the authorizations that are most relevant to the developer's data needs. We're looking forward to getting your feedback, and thanks for watching.